So CREDENCE is the only study of this SGLT2 inhibitor class in people with advanced kidney disease. And so it's unique in that regard. And not only that, it's the only one that has gotten an FDA label for not only kidney protection, but also for slowing heart failure or reducing heart failure events. So it's really unique in that regard. It has also taught us a lot about how these agents work in people with advanced kidney disease. And a lot of the early concepts, because they were done in people with better kidney function, actually thought to be a mild diuretic and glucose lowering agent. And turns out they're really cardiorenal risk reducing agents, with glucose lowering as a beneficial side effect, because when you get the GFRs down to levels of 25-30, as was examined in this trial, and in fact data presented like that, the bottom line was that you got no glucose reduction, and at the same time you got the same benefit that you got when you got glucose reduction. And of course, it's not surprising, because we have heart failure data from the DAPA heart failure study showing that if you don't even have diabetes, you got protection from this class of drugs. So it's not the diabetes that's really driving this, or the glucose lowering, it's other mechanisms. And so at this meeting, we did a lot of deep dive sub-analyses and looked at the subsections of GFR, and we looked at stage 3A, stage 3B, CKD, and there's actually a late breaker that I presented looking at the subgroup of people that came in with a baseline of less than 130 GFR. That was 174 patients that had the screening visit above 30 of a GFR, because that was the inclusion criteria, but then when the baseline data came, their GFRs were lower. In fact, the average was around 27. So those people were followed just like everybody else was in the trial. This dip in GFR that you see, or has come to be known with this class, was not seen. There was no reduction in hemoglobin A1C, and yet the decline in kidney function was the same as the trial overall. Heart failure benefit was the same as the trial overall, and so clearly this was another sign that this is not a glucose lowering agent, that its effects are independent of that. The other thing that's interesting was that blood pressure fell to a greater extent than what you saw in people with healthier kidneys, and even in the group that had GFRs that were around 60 in the trial. And the question is, why is that? And there's a study that was not presented here, but it's in press, showing that this class of drugs actually causes a type of renal denervation and actually reduces sympathetic tone and increases nitric oxide. That's going to appear in JAK. So you may hear about that at the heart failure meeting, or at the cardiology meetings. Well, I think the biggest gorilla in the room is diabetes, and a lot of work is being done in that area. There's a lot of work being done in focal glomerular sclerosis, which pales by comparison compared to diabetes. And if you're looking at sheer numbers of people that have problems, a lot of the kidney diseases are relatively rare relative to diabetes and hypertension. And so there's a lot of work going on there. There's work going on in other rare diseases. Polycystic kidney disease is actually a very common disease relative to the other kidney diseases. And there's a lot of work going on there, but there's been no real breakthroughs the way there have been now for diabetic kidney disease.